Continuing with the cycle of lessons on counseling skills for intervention, we make a first deeper analysis on the pedagogical skill model suggested by Dr. George Vera, in which we find three skill frameworks: the intellectual skills, the conceptual-procedural skills, and the operational skills. This time, we will bring a discussion on the operational skills for intervention that, as the name implies, take the counseling theory to operational approaches so that the counseling process can develop between counselor and client. Within the internal structure of the operational skills, we see three levels of complexities. We say basic, intermediate, and advanced operational skills. Specifically, we will take a look at the basic operational skills for intervention. As you may recall, the basic operational skills are the ones that are used to create the best professional conditions between the counselor and the client: empathy, rapport, attending behaviors, minimal verbal encouragement, verbal tracking, eye contact, observation, vocal quality and pacing, body language, exploration, and summary are the basic operational skills for intervention. When we speak of empathy, we are referring to a natural talent that can be developed with training. From the counseling perspective, we can say that empathy is the ability to perceive, understand, and respond to the client's emotional and cognitive experience from an encouraging perspective. Philosophically, empathy is what gives humanity to the counseling process, making it a deeply human and interpersonal encounter because it makes the counselor feel the client's experience in themselves as if it were their own. I perceive, I feel, I think, and I act. I perceive your pain, I feel your pain and the desire to help you. I think how to help you, and therefore I act to help you. This philosophical approach suggests that the feeling of compassion is possible due to the empathic ability. Indeed, as Tanya Singer indicates, neuroscience has found the neurological basis for empathy, demonstrating how empathy influences physiological and psychological responses to help others. In other words, how compassion is based on empathy. Therefore, technically, empathy makes it possible for the counselor to learn and positively exercise the rest of the operational skills for intervention. Empathy is so essential in counseling that it is the foundation of all the basic counseling operational skills, and, as a consequence, it also turns to be the foundation of those more intermediate and advanced operational skills. According to Dr. Vera's pedagogical model, empathy is an ontological operational skill deeply integrated with the intellectual skills in its analytical, emotional, and ethical layers. In this regard, if the counselor is not empathetic, the counseling exercise would be very limited due to not having sufficient human depth. The counselor would have serious difficulties in stimulating the changes to which the client aspires, and the counselor may become a simple advice giver, not being able to assist the client in developing their own positive change, nor in making proper decisions about themselves. In conjunction with empathy, rapport is the other essential human ability to exercise counseling or professional guidance. If empathy is about understanding the other, feeling compassion and wanting to act in aid of the other, rapport creates the appropriate and necessary emotional environment between counselor and client. So, rapport is one of the basic operational skills by excellence. Rapport is the human ability that allows the counselor to create an environment of warmth and proper understanding with the client to develop the counseling process. The demonstration of this ability takes place when the counselor assumes an open, cordial, relational, intentional, and inviting attitude to talk. For example, tell me about you. Let me know how can I help you. What issues bring you to counseling? What do you need from me to make you feel confident? How would this process be successful for you? These approaches make it easier for the client to feel listened to, understood, and ready to work their affairs with the counselor. On the contrary, If the counselor has difficulties in establishing rapport, then the counseling process would be superficial and insecure, making mistrust appear. The client would feel unmotivated, disinterested, not listened to, and would abandon the counseling process without having attended to the issues that brought them to the consultation properly. Instead of being a human encounter or agreement, it would be a human disagreement. On the other hand, attending behaviors refers to the counselor's concentrated attention to what the client says, how they say it, and how they express it physically and emotionally. Attending behaviors means to actively listen to the client, and for this, counselors must learn to make mental and verbal silence. Mental silence is that through which the counselor pays attention to what the client communicates without interpreting or reasoning. The counselor's mind is with the client and not elsewhere. Verbal silence implies not interrupting the client in their approaches and would only be stopped when the counselor does not understand what the client says. Attending behaviors helps the counselor to make an informative record about the client. If this skill is not well exercised, the client will not feel listened to or understood, which will generate frustration and demotivation. Clearly, a professional malpractice of counseling. In parallel, minimal verbal encouragement is also a skill utilized to make the client feel listened to and motivate them to continue their elaborations. This very technical skill is about cheering the client to continuing with their story delicately. Minimal verbal encouragement is expressed in short sentences. Some of these phrases that could be used may be, aha, ah, I see, I get it, I follow you, I realize, it is clear, please continue. It is important to be aware of the appropriate use of minimal verbal encouragement. The verbal encouragement is only used when the client's emotional state allows it. If the client is in deep emotional pain, they should be respected, and the counselor must not insist on obtaining more information at that moment. In combination with attending behaviors and minimal verbal encouragement, verbal tracking complements the counselor's intentional attention to the client. In this case, verbal tracking is the counselor's ability to pay attention to the subject that the client discloses while the subject gets more substantial. If attending behaviors allows the counselor to capture the client's subjective world, verbal tracking helps in identifying the different issues communicated by the client. And if necessary, verbal tracking also assists the counselor in stimulating the client to elaborate more on specific topics. Some ways on how counselors can do thematic monitoring and stimulate the client can be, a moment ago you were saying how your wife treats you. What if you tell me more about it? When you talk about how you felt about the news, what else was on your mind regarding the news? Besides talking about how badly it went with your cousin, you also say that you don't get along with other family members. What do you mean by not getting along with family? If, for some reason, the counselor is not able to track the client verbally, a loss of information will be produced, and the client may question the counselor's ability to follow their thematic diversity. With all this said regarding empathy, rapport, attending behaviors, minimal verbal encouragement, and verbal tracking, we invite you to join us in the next video in which we continue to understand a little more of the remaining basic operational counseling skills for intervention. If you like this video, please hit the like button and subscribe to our channel for more content. Thanks for watching.